that is one of our keynotes. And we've got somebody pretty special, as you all know. In the past 150 years, there has been twice as many U.S. presidents as there have been confirmed Surgeon Generals. Dr. Jerome Adams served as the 20th U.S. Surgeon General and only the second ever African-American male in that role. But his commitment to public health didn't begin with Dr. Adams' tenure as the nation's doctor. Over 2 decades, Dr. Adams received his master's degree in public health at the University of California, Berkeley, with a focus on chronic disease prevention. He's worked in both local and state public health, first at the City of Berkeley's Health Department, and later as the Commissioner of the Indiana State Department of Health, where he navigated Ebola, Zika, and HIV crisis. I'd say he's pretty well-versed. Long a fixture within the organized medicine community, Dr. Adams has been a leader in numerous professional societies and has practiced as an academic anesthesiologist over the past 20 years, even while serving as our Surgeon General. Most recently, he was named a distinguished professor and executive director of the Health Equity Initiatives at Purdue University. And last but not least, Dr. Adams recently authored Crisis and Chaos, a book about the COVID-19 pandemic. Yes, it was real. That is part memoir and part lessons learned. But the accolade that Dr. Adams is most proud of is that of Dad. Being the first Surgeon General in recent times to serve as the nation's doctor while also helping to raise 3 teenagers. Please join me in welcoming Dr. Adams.
All right, we're going to have a conversation, but I want to ask all of you, as you're able to stand up, because you've been sitting for a while, and you think better, your brain works better when you stand up, and as we often like to say as Surgeons General, we like to compare things to smoking, and they say sitting is really smoking. So stand up, raise your hands up, and please give a round of applause again to the award winners. I gotta tell you all, I didn't know how this was gonna go. You go ahead and sit down, please. I didn't know how today was gonna go. Gosh, I'm sitting there watching the award winners and listening to the award winners, and I'm getting media calling me, asking me to comment on Tylenol and autism. I'm getting pinged over and over and over again. And even this conversation that we're about to have, we're going to talk about some heavy topics. So it was good to start the day off hearing about all the great things that you all are doing out there. Oh my gosh, this was the best part of my week, coming here and hearing about all the fantastic things that you all are doing at these community health centers. Lowering hemoglobin A1C, increasing colon cancer screening. I just turned 50. I'm a lot older than what I look in those pictures. But I tell you what, I just got my colonoscopy done, getting my PSA checked, doing all the things that you all are trying to help community members do. So thank you all for all of that. I wanted to say that because I'm so importantly validate the work that you're doing.
There we go, thank you. All right. So, Dr. Adams, you have had a remarkable journey. From growing up in a rural southern community to leading the U.S. Public Health Service as the Surgeon General. Today, you continue to shape public health as the Executive Director of the Center for Community Health Enhancement and Learning at Purdue University with the passage of the One Big Beautiful Bill, which we're going to talk talk with you about. We're entering a new era of healthcare reform. And we want to explore that with you a little bit. And we're going to do this in 3 sections. 1, we want to talk about your personal journey and leadership. 2, we want to look at policy and reform, the one big beautiful bill. And 3, we want to look at inspiration and vision as we get through this.
Got to finish with inspiration, dude.
All right. So, growing up poor and Black in a rural community, what lessons from your upbringing do you carry into your work today?
Well, that's a great way to start. And I want to apologize to those of you who, in the audience who are triggered by the picture on the screen. And I'm not even joking when I say that. I recognize that we're in Virginia. It is a purplish state, but there are a lot of people in this room who, quite frankly, feel traumatized right now by what is going on, and honestly, who have a certain opinion of me because of who appointed me, and who were triggered again by this picture. But you asked the question, what did you learn? And one of the most important things that I've learned, and I've said this consistently throughout my career, that if you're not at the table, then you may find that you're on the menu. And so it is incredibly important to make sure you are at the table. Let's see, if my clicker is not, you can just advance for me. Or maybe not. Well, I grew up in rural southern Maryland. Nearest hospital to me was a community, was a critical access hospital about 45 minutes away from where I lived. As you mentioned, I grew up relying on government assistance programs. And again, so first of all, I want you all to know that I'm an independent. I don't believe Republicans or Democrats have a monopoly on good ideas or on bad ideas. And I go there and I try to advocate for help. But I did grow up relying on many of the government assistance programs that are being cut right now. I had 2 brothers, one with an intellectual disability, the other one with substance use disorder. They are both currently homeless right now. True story. They're both relying on SNAP benefits. Neither one of them can access Medicaid in Maryland. And so this is my reality. This is my reality growing up. I had straight A's all throughout school. I got 1 B in high school. I got 1 B in college. The rest were all A's. But I never dreamed I could be a doctor growing up, Tracy. And it wasn't because I didn't have the aptitude. It was because I'd never met a Black doctor in my life growing up. The only Black doctor I knew was Bill Cosby on the Cosby Show. We're not going to talk about him anymore. But that said, that wasn't something that I could envision. So one of the lessons I also learned, besides if you're not at the table, you may be on the menu, is you got to see it to believe that you can be it. And that's one of the reasons I feel the work that you all are doing is so incredibly important, because you're there in the community, talking to people, being a visible example of what they can achieve one day. And that's something you may not appreciate. Throughout my career, I still don't appreciate it. I have 3 kids. My kids put me in my place every day when I go home. I feel no special, attention or ability because I was United States Surgeon General, because my kids remind me very quickly, Dad, you don't know anything. But that said, every day when you all are in the clinic, you are a role model to somebody. You're a role model to a patient, to a kid who maybe that little kid right there who couldn't dream of possibly being in the position that you're in one day. So those are just some of the lessons I learned. And I talk about a lot of those in my book. I started the book the same way we started our conversation, with a personal story about one of the times that I almost died growing up in that rural community, and where it's people like you who really leaned in and saved me and allowed me to be here as a former United States Surgeon General.
So let's talk about your own health, okay? And you've been very open about your health care and your situation. And you've talked about You're high blood pressure, asthmatic, being pre-diabetic. How has that shaped you and your health condition? How has that shaped your experiences and your approach to public health?
Well, it shaped me in a number of ways. We have all kinds of conversations now about the D and the E and the I. I was the director of health equity at Purdue University. Again, not being partisan here, just telling you my story, until the state decided that I couldn't be the director of health equity anymore at a state university. And so my title got changed. Interestingly enough, the majority of my focus of my work was on rural health. And so fortunately, they had the wisdom not to actually cut me, but I had to change my title. But I lean into these issues because I understand from a very personal level that a lot of us are born in situations and circumstances that have nothing to do with the choices that we make. And I've worked for 3 Republican governors. I've worked for Donald Trump. I very much understand and believe in a lot of what comes behind the push for more personal responsibility. I'm Catholic. Interestingly enough, most African American families will tell you in their own homes. There's a lot of conversation about personal responsibility and about teaching your kids that they need to depend on themselves and not on others. But I also understood in a very real sense, growing up poor and black, that there were circumstances around me that were dictating my health outcomes that I had no control over. I had no control over being born with black skin. But we know that kids who are born black are 2 times as likely to have a hospital stay from asthma, 3 times as likely to die from asthma, 4 times as likely to visit the emergency department due to asthma. I visited the emergency department growing up. My dad loves to tell the story because it makes him feel, I understand the role that he played in me being here, but he loves to tell the story of me being in the emergency room 23 times in 1 year when I was growing up. So it's actually amazing that I was able to keep the grades that I got, considering how much school I missed being in and out of the hospital. But I understood there was a burden. Driving down here in Roanoke, I understood there's a burden growing up in a rural community where we didn't have a pediatric, pulmonologist, someone who would specialize in the care that I needed. And I understood, I understand now that the medications that they used weren't tested on people from different racial and ethnic backgrounds. They were giving me the wrong medications, or at least not the best medications for me growing up. I understood that every time the combines went through, and you all are in Virginia, so you get this. We literally grew up surrounded by tobacco fields. I grew up working in the tobacco fields. And I have asthma. And so no wonder I was in the hospital over and over and over again. But I worked in the fields because that's what we had to do to put food on the table. If I wanted new tennis shoes, if I wanted the new Nike tennis shoes that Michael Jordan was playing, that was playing in, I had to go out and work in the tobacco fields to earn the money myself because my parents couldn't get them for me. And then, I ended up in the hospital too, a week or 2 later, once that asthma got flared up. And so I truly try to take that upbringing and bring it to the table. So you heard, I believe it was Colleen talking about the importance of stories. Data plus stories is how you get advocacy. You need both. You need the data to back it up, but you need those real stories. And when I was sitting in the situation room, I was the only dad in the situation room having conversations about COVID. And my wife was literally on the phone like, you better not shut down schools, because I don't want to have to take care of these 3 kids here by myself. But again, telling that story, it makes it real in a way that these abstract conversations that we often have don't make it real. And me being there telling a story, one of my proudest moments, this is the proudest moment, and it's the saddest recollection right now, was I was at the White House behind the podium with the President of the United States, the leader of the free world, standing next to me, and I held up my inhaler and I was talking about asthma. And it was one of my proudest moments because how are kids with asthma usually portrayed on TV and in movies? They're portrayed as weaklings. I was there as a vice admiral in my uniform, but the President of the United States looking at me, holding up my inhaler. And in that moment, all I could think was, what if there's a little black kid, a little black boy out there watching this right now who has asthma, who thinks he's weak because that's all he sees on TV, and all of a sudden he sees me there. Am I providing the hope for that person to continue on? And I tell you, it's one of the greatest stories, but it's also one of the saddest stories because my wife refuses to let me, there was a meeting, we were in the White House press room, so lots of media took pictures, but there's a really great picture of me standing there, flanked by the president and the vice president of the United States. Ordinarily, that would be one of the proudest moments of anyone's life, much less a poor black kid who grew up to be in that situation. And my wife refuses to let me put that picture in my house because she's worried we're going to be targeted by people, again, who come in and see Donald Trump posted on our wall, and all of a sudden start thinking things about us or our kids that may not be true. And so, you know, I tell you that because the stories are actually what matters, and that upbringing is really what I try to bring with me. I also told you about my brother Philip, who's currently homeless. He's currently living out of a car. I talked to my dad about it yesterday. And it doesn't matter how much money I have, I can't dig him out of his hole by myself. Because he lives too far away, because he's in a rural community, because they don't have good substance use disorder treatment, because he's got stigma attached to it, because in this small town, everybody knows who he is and knows that he's been in and out of jail the last 20 years. And so it's so incredibly frustrating to me to feel like former Surgeon General, make good money, and you can't help your own brother. But what could I do? I actually went to Washington, D.C. again. Many people, including some of you on this room, he said, you shouldn't go. You shouldn't be there. But I went there and I talked about substance use disorder. And I talked about my brother who was in prison at the time. I was in the White House. He was in the big house while I was in the White House, in Jessup, Maryland. And we did that to lower stigma around substance use disorder so people could understand what happened to anybody. And we did that as a way of helping promote treatments for substance use disorder. And I'm actually proud to say that when you look back, the now leveling off in some communities and decline in other communities related to the opioid epidemic, if you trace it back to our first tenure in the White House, when we really leaned into, again, naloxone, we leaned into medication-assisted treatment. We got the president behind medication-assisted treatment. In a Republican administration, we actually talked about syringe services programs and harm reduction. Again, that's what being at the table accomplishes. It's taking that story, taking the credibility that you have from your education and your background, and using it to impact policy.
I appreciate you sharing a lot of what you said with your background, your journey, your brother's journey, and the compelling stories. And I'm going to go a little bit off script here, folks. But one of the things that, as an association that does the advocacy for the community health centers and for the communities that we serve, and although our membership are community health centers, we look at ourselves as representing the communities that these health centers serve, and many are rural. And you talked about the access you didn't have. And we focus on the access that we need, that we know that kids like you growing up needed. And now with your brother in his circumstances. So what do you say to us when we're out here just doing everything we can to try and keep our communities healthy? What do you say, and how do you help us to tell our stories to this administration, knowing some of the decisions that have come down through the big, beautiful bill?
A couple of things I would say. Number one, it is, and I love that you got the health LAs from your senator's offices here, that you recognize them, because they're who I work most closely with. And in Washington, D.C., I prided myself on working, across the aisle. And I told people, I'm the United States Surgeon General. I'm not Trump's Surgeon General. I also talk about that in the book. It is incredibly one of my pet peeves, and the media still does this to this day. If you look at Jerome Adams right now on your phones and news, it probably is a headline that says Trump Surgeon General. No other Surgeon General in history is recognized by the person who appointed them. But Trump is such a trigger. He's such it's page clicks that I'm framed through that lens. And what I say that because I tell you what, I have fought my entire professional career to be nonpartisan. When I go in and take care of someone, and I was in the operating room on Monday of this week, providing anesthesia. I don't ask my patient, I say, I check their blood pressure, I check their hemoglobin A1C, I ask them about their medical history. I don't ask them if they're Democrat or Republican. And they don't ask me as their doctor if I'm Democrat or Republican. And so I say to you all, it is incredibly important that we try to be nonpartisan, not apolitical, because you can't be apolitical because politics and policy impact so much of what we do. But you try to be nonpartisan, but you're also honest. So if you're struggling, we actually did a survey at Purdue University of local health departments after the One Big Beautiful Bill came out, asking them how many local health departments are looking at cutting services because of CDC funding being cut, because of Medicaid funding being cut. And it was almost 70% of our health departments are looking at funding cuts. That is not partisan or political, that's actual factual data. And for your senators and your members of Congress, it is incredibly important that you all tell the stories of your patients. The challenge with data, and I don't in any way, shape, or form want to push back against data, but everybody's got their alternative facts now. Everyone's got their own version of data, but no one can invalidate your story or your patient's story. When you walk in to your senator's office, to your congressperson's office, and you say, I had a patient and this happened. We had to cut this staffer because we ran out of funding. This hospital closed in this community. That's not data anymore. That's not alternative facts. That's a real story that no one can invalidate. And so I think that is important. I think it's important we have events like this. And thank you so much again for recognizing, because every day as you all are grinding, it's easy for you to feel down. And it is so important you come here and hear about the good work that you all are doing. And understand that we will get through this time. One of the things I often remind people of, and this is to be fair, not to be devil's advocate, but to be fair to the current administration. The status quo wasn't working. It wasn't working. We were spending more on healthcare than any OECD nation and getting terrible results. Some of the highest maternal mortality in developed nations, some of the highest infant mortality in developed nations. Over half of our adults, with high blood pressure. Almost a third of our adults with diabetes or prediabetes. And so you can't argue with the premise that what we were doing wasn't working. And so now is an opportunity to say, okay, how can we pivot? How can we take advantage of this disruption to recreate systems in a better way? And I also, and Tom, I'm sure Dr. Frieden will talk a lot about this because he loves talking about this. We're at a moment in time now when you look at AI, when you look at personalized medicine, when you look at drugs like GLPs that are available to help with stroke and cardiovascular disease and kidney disease and Alzheimer's. When you look at hepatitis medications that now can cure hepatitis C. When you look at Yestugo, I believe it's called, the new HIV medication that you take twice a year and as PrEP and can eventually prevent HIV. We have so many advancements here now that I'm incredibly heartened by the opportunities to promote health. I'm just, concerned that these advancements aren't going to be available in an equitable way to our communities, and that's where you all come in.
So, we need to learn, and I have a lot of this conversation with members and the CEOs especially, that you talk about how our healthcare system, it needs to change. That being said, I think we recognize that. But one of the things is that change is hard, okay? And now we have to learn how to learn new language. And language in a way that resonates now with our communities, because they too are either one, voting for this kind of change, or two, just trying to adapt to what that change could be. So how do we build trust and connection now, right? How do we build trust and connection in the communities that, one, we feel left behind, but two, are feeling we're okay with this?
Well, I love that because and it reminds me of the situation I had to deal with when I was health commissioner in Scott County, Indiana. So this is a rural community of about 4,000 people, and they never had more than 2 recorded HIV cases annually in history in this community. And in 1 year, we had over 100 cases of HIV. In about 18 months, we had about 180 cases of HIV in that community of 4,000 people related to injection drug use. Had a higher HIV incidence and prevalence rate than anywhere in the world, including sub-Saharan Africa at the time, this rural white community. And what's interesting about that is the scientists, the textbooks, the public health books all told us exactly what we needed to do. You need to go in and you need to implement a syringe service program to break transmission of disease. But guess what? Syringe services programs were illegal in the state of Indiana at the time, as they were in most red states. And my governor at the time was Mike Pence. My boss was Mike Pence, who helped lead the charge when he was in Congress to prevent funding for harm reduction harm reduction programs. So that was the scenario I had to deal with. Science said this, but the actual policy environment said 180 degrees opposite. We also were dealing with, again, a rural, white, highly conservative community. Interesting about that community is 200 cases of HIV, but you couldn't go through the streets, and I would walk the streets of Austin, Indiana many times. You literally couldn't throw a stone without hitting a church. Churches everywhere, everywhere in that community. And so this was not a place where I was going to be able to come in as the Black Health Commissioner from Maryland, which is where I grew up, and tell these people, we're going to open up a syringe service program, even though that's what the textbooks said. And so you asked a lesson that I learned, and I pass this along to you all. If you take nothing else, and you already know this, I know I'm preaching to the choir, but it's a mantra to remind yourself that people need to know that you care before they care what you know.
People need to know what you care.
Know that you care before they care what you know.
Before they care what you know.
So I didn't stand behind my podium in Indianapolis and say, thou shalt have a syringe services program. I drove down to rural Scott County, Indiana. And let me give you a little more context here. Literally, the first time I drove into that community, I drive by and there's a trailer park with Confederate flags, hanging in the trailer park. There was actually a KKK flag flying at a house that was right next to a park in that community. That's the community that I'm going down to work with. It would have been easy for me to say, nope, turn the car around, drive back to Indianapolis. But I actually went to the churches, I went to the schools, I went to the local jail, and actually walked through the local jail and talked to people in jail who had substance use disorder, and did HIV testing in the jail. I went to dinner with the local sheriff. And once they got to know me, not as the health commissioner on high, but as Jerome Adams, who came from a community very similar to ours, and who had dinner with us, and who broke bread with us, and who went to church with us, and prayed with us, they all of a sudden said, okay, you're an all right guy, and you really do care about us. So what do you think we should do, Dr. Adams, to end this outbreak? And I say that because, the honest truth is, we can be pretty preachy sometimes in healthcare and in public health. We shame people for not being vaccinated. We shame people for, I talk about this in the book a lot. We shame people a lot during COVID. Joe Biden literally called this a pandemic of the unvaccinated. Again, not being partisan here, I'm just giving you facts. So that means if you were unvaccinated, it's not because you were concerned about the impacts this was going to have on your kids. It meant you're a bad person. And so we have to understand that we have to create that relationship. And again, I know that's what you all do each and every day. But what I would say is just be cautious of the subtle cues, the small things that you can do to perpetuate stigma in this community, particularly, again, with the rural population who tends to lean heavily conservative, whereas we come from a health and public health background which tends to lean heavily left. The language we use, the ways that we talk about things can be often off-putting to people in a way that we don't even recognize. And so we've got to show people that we care with our words and with our actions, and then they'll open up to being willing to hear what we know. Vaccines, again, I'm very, very, very worried about. We got an outbreak right now in Utah and in New Mexico, just off the Texas outbreak. We had an outbreak in Wisconsin earlier this year where several kids got measles. I'm very worried about that, but I think here's something that is positive. Even though trust in healthcare institutions and government institutions is at historic lows, people still say the number 1, 2, and 3 people they trust for health decisions are their doctor, their nurse, their pharmacist. So you all. They trust you all. They don't trust doctors. They don't trust medicine. They don't trust the AMA. They don't trust the CDC or the FDA. They trust you. So remember that. Remember that trust is there as long as we don't violate it. And you all have a powerful opportunity to be able to advance the information that is going to be necessary for us to actually make a difference.
Good advice. Very good advice. I share with folks, and I said this while here yesterday, had a story very similar to yours. It wasn't HIV related, but it was COVID vaccine related, and one of our public health departments had a patient who came. We have an STD breakout here in some rural parts of Virginia, and we had a case that had come into one of the local health departments. Clearly she was sick, you can see it. They put her in the exam room, and she was meeting with the clinician, and the clinician was getting ready to examine her, and she just happened to look up and saw a sign that said, if you want to get your COVID vaccine, you can get it here. And she said, do you do that? The patient said, do you do that here? And they said, yes. And she said, I'm out. And she picked up her bags, and she proceeded to walk towards the door, got her partner, and they left. And they suspected that she was pregnant too. So, I think that's very telling what you're saying to us, because we do have to get used to that. Because the only thing we look at is how can we help make this person better.
Yep.
Right?
And again, you got to start with, any one of you all who, I am a dad, I have 3 kids, they get on my nerves, but I love talking about them. And oftentimes one of the first things that'll come out of a conversation with me, usually after 30 seconds, is me asking you if you have kids, because I love talking about kids. And whether you're Republican or Democrat or whatever, people who have kids love talking about their kids, even if it's just to complain about them, and you create a rapport. There's another story that I tell in my book. This is a true story. I was in the operating room late one night, and this person comes in the operating room, and I look through his chart, and then we take him back to the operating room, and he's in the operating room, and I've got to pull his sheet down and put the EKG pads on. So that we can actually do the case. And he has the sheet pulled up, like up to his neck. And I go to pull the sheet down, and he won't let me pull the sheet down. He goes, sir, we got to put the EKG pads on you. And I know they're a little cold, and I said, I promise we'll be quick. And he relents, and I pull his sheet down, and he's got swastikas tattooed all over it. And guess what, y'all? There's a black man about to have his life in his hands. And so he didn't want me to see what was under that sheet, because he thought it was going to compromise his care. And so I remember looking through the chart that he had kids. And so as I'm pulling down the chart and putting down the EKG, I asked, how many kids do you have? How old are your kids? And we start talking about our kids and complaining about our kids to one another. And we got through that case. And it's not that I converted him from being a racist, but I tell you what, if I treated him with disdain when I saw those swastikas, it would have justified all the racism that he held in his heart that caused him to get those swastikas tattooed all over him. And so I could have actually done damage there. But I found common ground. I found common ground between me and someone who had racist symbols tattooed all over him to get through what we had to get through in that moment. And I tell you that story because I think it's an important metaphor for how we've got to get through some of these moments right now. We've got to realize that we all have more in common than what there ever could be that separates us. And there's a whole outrage industry out there that's set up around pointing out the differences that we have between us and making us angry at one another and making everything framed through as an existential threat to your existence. If this person is a Democrat and you're a Republican, if this person voted this way and you voted that way, then they are your enemy. They are your enemy. And if we focus on that instead of focusing on what we have in common, we're going to continue to see more the same. My wife is from rural Indiana. Her dad worked was a farmer at first for most of their life, and then worked for Marathon Oil, in an oil company. He owns about 50 guns at his house because he grew up in a rural community, and that's what you do. And he is a big Trump supporter. This is a true story. He also loves my grandkids more than you could ever love anyone, ever. These two things are in the same person. And so, people can look at him and say, you're a terrible person because you voted for Trump. People can also look at him and say, you love your grandkids and you would do anything for your grandkids. And so even within our own families, I think we have to say, okay, how do we find the commonalities instead of focusing on the differences?
Totally agree. Okay, now we're going to switch over. And we're going to get a little bit into policy and reform. And one is the One Big Beautiful Bill. And that's really driving a lot of our decisions as healthcare workers and what we can and cannot do, what we should offer, what we shouldn't offer, the kinds of services we should provide, where we should be located. But then also trying to measure that and weigh that against financial stability. So the One Big Beautiful Bill, all right, it expands HSAs, healthcare savings accounts, supports direct primary care, and makes telehealth coverage permanent. What opportunities do you see for community health centers to be able to leverage those changes in the bill?
I love the way you asked that question because we can talk about the challenges and the problems with the bill all day, but again, status quo and I think there are real opportunities. Telehealth. We've been talking about telehealth for 30 years, and it wasn't until 2020, the pandemic, that it really pushed us off the fence post and forced us to embrace telehealth. And guess what? The sky didn't fall when we embraced telehealth. Telehealth increased by some studies 7,000% during the pandemic. And post-pandemic, up until the One Big Beautiful Bill, we've been worried that a lot of the regulatory relief provided to facilitate telehealth was going to be pulled away, and then we wouldn't have the funding to continue it. Now, here's the challenge with telehealth. Remember, I told you my concern is about equity. Telehealth increased 7,000% during the pandemic. It disproportionately increased in suburban, affluent, and white areas. Why? Because those people have broadband. Those people have big houses. Why does a big house matter? Well, do you want to have a telehealth appointment with your psychiatrist in a small little house with 7 people in it all listening in to your conversation? So even that matters. They have computers and equipment that is up to date. And so I think telehealth is a tremendous opportunity to increase access to care, particularly to rural communities where they may not always be able to go in, like I said when I was younger, and see a pediatric pulmonologist in a small rural community. But you can have a telehealth appointment with a pediatric pulmonologist at UVA. No matter where you are around the state, you can do Project Echo, which I'm sure many of you will have heard, where you're empowering local providers to be able to provide that care. We used Project Echo in Austin, Indiana, where we were empowering local primary care doctors to provide HIV and hepatitis C care, which usually in a small rural farm community, you don't have a hepatitis specialist or an HIV specialist. And so I think that's a tremendous opportunity we have through the One Big Beautiful Bill. We also know financial literacy and healthcare literacy are social determinants or social drivers of health. And so as we have more opportunities for people to use HSAs, it is going to be incumbent upon us. And I love that you recognize not just clinical people in your reports, but you recognize a lot of the people who are the backbone of what we do, the controllers, the finance people, the people who do technology. We have a real opportunity to educate people about what an HSA is and to understand spending. I mean, most people in the United States who have employer-sponsored insurance are now in high-deductible health plans. So I'll tell you, I had this in here because I didn't know if it would come up, but it's a great point in time to put this in here. So about a year ago, I went to Scottsdale, Arizona for a conference like this one, Society of Critical Care Medicine meeting. Went for a hike at Camelback Mountain. Anyone ever done that? So Camelback Mountain, this famous place. Yesterday I hiked up to the Star here in Roanoke. I love the trip to take in the local community. So Camelback Mountain is there, Roanoke Star. So I hiked up to the top, came back down, went out to dinner like many of you all did last night. I had a glass of wine like many of you all did last night, and got lightheaded at dinner. And I told you I just turned 50, so I'm there with a bunch of doctors. And you need to go to the hospital and get checked out. You're 50. You may be having a heart attack. There may be something else going on. I knew it was dehydration. We knew it was dehydration. Out of an abundance of caution, they told me, to encourage me. And so I went, had to take an ambulance because I'm, in a different state. We go there. They give me a couple of bags of IV fluid. They do my Chem 7. It's dehydration. They keep me another 8 hours or so to rehydrate me and just watch me because it was late at night. Discharging me at like 5:30 in the morning. I go back to my hotel room. Think nothing of it. A few weeks later, I get a bill for $10,000. $10,000 for several bags of IV fluid and a Chem 7. And I tell you that because medical debt is a leading cause of bankruptcy in the United States. And some of that, a lot of that most of that is a system. But some of that is financial literacy and people not understanding how to navigate the system. Now, I told you the story though because we were having a conversation about high deductible health plans. I have a high deductible health plan. So guess what? Even though I have the best insurance you can have at Purdue University, one of the best universities in the country, I also have a high deductible health plan. This happened in July before we filled up our HSAs. So my $10,000 bill got negotiated down to a $5,000 bill. How many of you have $5,000 sitting around to pay Mayo Clinic? $5,000. And so these high deductible health plans, people need to understand what they are, what they're choosing when they pick these plans. They need to understand how to negotiate them. They need to understand how to really leverage the system. Because I think it's a farce when people talk about healthcare as a marketplace. You can't have a free market if you have no transparency in pricing. And if someone came into my operating room on this Monday and came to me and said, Dr. Adams, how much is your anesthetic going to cost me? I had no freaking clue. One person, it may be free, literally free to them. The next person, it may be $10,000. But that said, we need to help. There's an opportunity here to educate people about financial literacy, particularly in the medical space, so that they understand how to get the most out of their plans, and so that they understand also how not to harm themselves. You all also know it's a time of year when people who have insurance are literally burning through their HSAs and their FSAs and going in trying to get their surgeries in at the end of the year because they hit those deductibles. Unfortunately, that's part of understanding the system and helping your patients understand how to leverage that system and get their test or their screening or whatever they need done in December instead of in January when everything's reset all over again.
Good points, very good points. I'm for my team, my head is kind of spinning on the idea around, helping educate our communities around how health insurance works and things like that.
You all have waiting rooms. And people sit in those waiting rooms. So putting up a panel, putting up a flyer, don't make it complex, just something simple. And now with QR codes and websites, you can put something simple, and someone who wants to learn more can just scan and learn more. What is an HSA? The same thing for vaccines. We want to learn more about a vaccine. And the story you told, it breaks my heart. But one of the things that I also encourage you all to do is to make sure you walk the talk and talk the walk. And what do I mean by that? Hopefully, you all are all planning on getting your flu and your COVID updates. I got mine 2 weeks ago. But do it. Tell your patients about it. Talk about it. And not in a judgmental way or a pushy way, but just, I got mine. Because the one thing, people can argue about mRNA this and, and vaccines that, and gain of function and all that. But when my patients ask me, I say, well, I got it. And my kids got vaccinated. And again, that is a more powerful way to convince someone than all the data in the world about why they should get it. Your colonoscopy, your breast exam. Make sure you're getting it yourself. Because you can't tell other people they should do it if you don't do it. But then also, make sure you're sharing your story because that is a validator for a lot of folks.
So some say this bill Uberized healthcare, right? Removing health insurance middlemen and giving patients more control. What are the risks and rewards of this shift, especially for underserved populations?
So, what's interesting about that is it gives patients control, as I mentioned, if they know how to exercise that control. But W.O. Jennings said every system is perfectly designed to get the results that it gives, and a bad system will be a good person every time. There were a lot of changes in the One Big Beautiful Bill, but there's a lot of things about our system that weren't changed. And one of them is that healthcare is not health. And so, with all due respect to all of us, I'm a healthcare worker too, we need to understand that only about 20% of our health is determined by what happens within our walls, in our clinics, in our hospitals, in our facilities. The other 80% of health happens outside those walls. It's transportation, it's housing, it's childcare, it's a living wage. And so I say that to say that this bill is giving patients more control if they know how to exercise it, number one, so education is important. But number two, it's giving them more control over 20% of the problem. It's still going to be hard for you to eat healthy if you live in a food desert. It's still going to be hard for you to go in and get that preventative screening that you need if you don't have transportation. It's still going to be hard for you to participate in a telehealth appointment if you don't have broadband access, good broadband access in the community that you live in. So we need to understand that as a challenge, but also an opportunity. And I also talk about in the book the fact that health equity, we can't be a healthy nation without health equity. So again, these changes in the bill, every innovation that we've had in recent years has increased lifespan, health innovation, but it's also increased disparities. And it increases disparities because the haves have access to it and the have-nots do not. Breast cancer screening is a great example. This new breast cancer screening technology detects breast cancer earlier, and the earlier you intervene, the less morbidity and mortality that you have. Well, guess what? Not everybody's insurance pays for the newest screening modalities, and not everybody has insurance. So the haves, people like my wife, get access to the highest quality, newest innovations, where the other people don't. GLPs. I mean, again, I just told you earlier how amazing GLPs are. They truly are. They're a new miracle type of drug when you look at all the things that they can do. You know who the people who are most on GLPs are? Affluent white women. You go through my neighborhood, and I'm a doctor, I live in a nice neighborhood, you all, and I can guarantee you that over 50% of the women who live in my neighborhood are on GLPs, and most of them wouldn't qualify for it if they didn't know how to work the system, if they didn't have, great health insurance. But people who do need to be on the GLPs, people who are in U.S. clinics with the A1Cs of 10 and 11 and 13, can't get them. Can't get them because they don't have insurance that will pay for it, because they don't know how to navigate the pre-authorization systems. Again, there's that health and finance literacy that comes in again that allow them to get on these medications. And so I think the One Big Beautiful Bill is saying the system is broken, which we can't argue that. Again, no matter the side of the political aisle you're on, you can't argue that the system is broken. You can't say we need to go back to the way things were. You have to say the system was broken, I agree with you. You know the best way to diffuse an argument? I figured this out with my wife and my kids. The best way to diffuse an argument with anybody is to start with where you agree. To say, you're right. No, to find a way to say, you're right. Then what are they going to argue against? And no matter how you feel about what's going on in D.C., they're right. The system is broken. They're right. We aren't focusing enough on prevention. All right, we agree on that. Now let's talk about how we get to a better place. I think that's what we should be doing and focusing on. Even as we're sharing stories. So it's not a war, it's an and. As we're sharing real world stories about harm that is being done to our constituents because of some of the negative changes or unintended consequences.
So that's all well and good. And I think we all can agree that we definitely need to have changes, and we've talked about that. But we also are seeing in this bill, as well as our interaction with our department that oversees the Community Health Center program, We also are being told to do and say things differently from what we've always been used to doing. And really, it relates to our mission, right? So knowing this landscape that we're in, how can we still live through this landscape, adapt to some of these changes? We know we want to make some changes. We're open to willing to do this. But how do we still stay true to our mission of equity and access?
No, I love that. And so number one, I would say talk to Colleen and Samantha. They will tell you, I've been in politics for a long time. This too shall pass. You know, it's amazing how much we can get bogged down, and understandably so. I don't want to invalidate anyone's fear or concerns about what's going on, but we can get bogged down into today. But things will change, and so, you know, in the future, there will be different leaders in positions in different places. And so we need to focus on our patients and our work. And that's what I try to do. I try to go in and do the best job I can do every day. Now, I want to give you a practical answer to this too, and I'm going to jump to something that I wanted to close with. But I don't want people to feel like I'm ignoring what's going on at the moment. And so there's a lot going on. But what can you do? You can collect data about the impact of different policies. So in each of your clinics, again, and this is what we did with health departments in Indiana. We collected objective data about what is happening at the ground level and shared it with our legislators. You can share stories, as I mentioned. Be a megaphone for those who don't have one. You know, Susie came into my clinic last week and she lost her insurance. You know, or you know, the story that you tell of the patient who came in who was sick and walked out because of their COVID vaccine. Sharing those stories with legislators sways them in a way that, again, Colleen and Samantha will tell you, you would be surprised how few people it takes calling in a phone line to their legislator to make it seem like there is a tsunami of concern. My son actually worked for Senator Todd Young this summer, answering the phones. And so I can tell you, they log the phone calls, and then they go to the senator and say, you got 27 calls today about X. And all of a sudden the senator goes, oh, well, I guess X is an issue. And I tell you that just sharing those stories, even a small number of stories to your legislators can make a big difference in terms of what they prioritize and how they feel about a certain issue. Josh Hawley, any of you all know Josh Hawley? Very, very conservative MAGA Republican for Missouri. He also came out hard against the Medicaid cuts in the One Big Beautiful Bill. Why? Because people from his community reached out and said, this is going to cause closures in our district. And so I'll tell you that those stories actually mean a lot. Engage, help promote civic engagement. We were talking about this earlier, Tracy. Do you know that when people are civically engaged, their cortisol levels drop? They actually done scientific studies, so it's good for their health. Just feeling like they have control over their fate in some way, shape, or form. So encouraging them to call their senator or their congressman. Encouraging them to get registered to vote. These are important things you can do in a nonpartisan manner. I don't care who you vote for, but it's important you sign up and vote. And it's important that you understand, you know, the policies that different people you're voting for are supporting and the impacts that they have on your community. Support philanthropic efforts. That is incredibly important because whether we like it or not, we're in an era where federal and state dollars are being pulled away from a lot of what we do. But there's a lot of foundations out there that are looking for opportunities to fill in the gaps. And so the more we can work with them and say, we've got this great program at our community health center. If we could only get an extra $100,000 to fund it, we could help this many people. That's where the data actually comes in and does help. And that there's tremendous opportunity there. Every big business or middle-sized business or even small business in your communities often has a family foundation that they have, that they're donating money to. And if you can go to them and show them data and show them real projects, you can actually get some funding to fill in those gaps. And then, as I mentioned, innovate. Take advantage of the opportunity to forge new paths. Because the old path was not working. What we were doing was not working. So I say those things to give you real answers and not just platitudes about things that you can be thinking about and doing in this moment to help your patients and to get through what for many people is a trying time.
You gave us a lot of good things to think about, and I want to close with looking at some. You talked to us about some really good technical things that we can focus on, and these are a lot of things that we've also talked about in a lot of our meetings. But I want to also kind of move us a little bit further as we look into our future and as we go into our future. And you've led through crises. We've gone through a massive pandemic, and we were at the front and center of that. You have the opioid, and we're experiencing that here in Virginia to COVID. So what's one moment, right? What's one moment that reminded you why this work that we're doing really does matter?
Well, I talked to you about the opioid epidemic before, and a couple moments. So number one of my proudest moments on a federal level was putting out my naloxone advisor. And it's easy to forget that when I put this out in 2018, we still had first responders, police officers and firefighters who weren't willing to carry naloxone. And we put out this advisory, and we saw naloxone dispensing go up 400% nationwide. And again, if you trace back, that is when we started to see a slowing in the increase in opioid overdose deaths, and then a leveling off, and then a decline. So I'm incredibly proud of that work that we were able to do. We were able to do it by lowering stigma and sharing stories. So that's number one. On a state level, I'm proud of getting syringe services programs legalized in the state of Indiana under a Republican governor. And we saw that other states then followed suit. Kentucky legalized syringe service programs. Ohio increased syringe services programs access. West Virginia and Virginia pointed to, hey, Mike Pence did this in Indiana, so we can do this here. And so again, I share that with you to say that, again, if you're not at the table, you're at the menu, when you're on the menu, but when you're at the table, you never know the opportunities you're going to have to be able to advance health. I'm proud of the work that I did on Operation Warp Speed. So my contribution to Operation Warp Speed was actually increasing diversity in the clinical trials. Because we were incredibly worried that we were going to have these great vaccines, but the people most impacted by COVID weren't going to take them. And we were worried about Black and minority communities because we know that they traditionally have a high level of mistrust of anything new. And I was fighting headwinds. Again, not being political, but the highest ranking person in 2020 to say that they wouldn't trust COVID vaccines was not Donald Trump, was not Ron DeSantis, it was Kamala Harris and Andrew Cuomo. Kamala Harris said, I will not trust a vaccine that comes out under this administration. Andrew Cuomo said, we will not trust the FDA if they say to take this vaccine. We're gonna review it ourselves. And so I say that because I worked hard to get the diversity in those clinical trials to where they were the most diverse clinical trials in history by the time they were done. And it breaks my heart now that people won't accept these life-saving vaccines. You know, it reminds me of that story they tell where a man is, in a boat and the boat's sinking, and someone comes by and says, hey, let me help you because no God's gonna save me. And then another boat comes by and no God's gonna save me. And then the boat sinks and he drowns and he goes to heaven and he sees God and he says, God, what happened? He goes, I sent all these people to try to help you, and you kept turning them away. Well, God gave us these vaccines, these amazing technologies, and we won't take them, and now we're defunding mRNA technology, which also could be used to cure cancer. And so my proudest moments are also oftentimes, as I reflect on some of the most trying times that we're in. But I'm proud of the bipartisan work that I've done. Senator Kane, please tell him thank you for voting for me. I was actually the longest tenured, fastest confirmed, and the only, I think, Trump appointee from the first administration to be approved, but unanimously. And I worked across the aisle to do that. So that's me before my confirmation hearing with the White House underneath his official portrait. But I love shows you that we can come together across aisles. And I'm incredibly proud of the work that I've done. There's me and the President of France, international, me and Robert Roberts on Good Morning America, and of course me with the leader of the free world. And so I'm incredibly proud of the bipartisan work that I've done. And I say that to you all because there's nothing we can't accomplish if we find commonality, if we work together. There's nothing we will accomplish if we focus on what separates us, if we continue to be divided by the outrage industry who is profiting off of keeping us at each other's throats.
Okay, so saying all of that, what gives you hope for healthcare in America?
What gives me hope is all of you all. I loved working with HRSA when I was Surgeon General. I loved going out to visit community health centers. A lot of the work I did, again, once the vaccine came out, and all during COVID, I went to community health centers and opened up testing sites. You all were literally, when I went out, I was like, okay, we got to go visit a community health center when we're doing our tours. Because they always have the governor there, they'll always have the senator there, they'll have the bigwigs there, but they won't have anyone who knows the ground truth. And what I learned very quickly was that having someone from their state, their community, their district, running a community health center, who was part of a community health center, sitting there at whatever roundtable we were having, whatever audience we were having, oh my gosh, it completely changed the dynamic of the conversation. And it provided information. So what gives me hope is you all and the work that you're doing every day. I can't wait to leave here and brag about the work you all are doing to increase colon cancer screenings and to lower hemoglobin A1C. That is fantastic. That's fantastic. And that's the crazy thing is as much as I'm a big fan of the innovation, we actually don't need Ozempic to lower hemoglobin A1C levels. We just need people like you all actually out there doing the things that we know work, getting people engaged with care. So that gives me hope. And again, I really do feel like we didn't have time to go into the AI and tech side of things, but we are at a watershed moment in terms of healthcare. And I'm not talking about from a policy perspective, but from a tech perspective. The things that are possible now and will be possible in the next several years in terms of data, understanding what's going on with our patients on a population level and on an individual level. The ability to be able to even interact with our patients. We talked about telemedicine. Well, guess what? The new technology, chatbots can help us overcome language barriers. We can now call up, have a chatbot call up our Haitian community or our Hispanic community if we don't have someone instantly available who can speak Spanish, and speak to them in their language, in their dialect, and respond to them in a way that, I'm sure most people have heard this, but they actually did studies with a chatbot compared to an actual physician. And the patient rating of the chatbot is having higher levels of empathy and competence than the physician. Because the chatbot can actually react in real time to what you're saying, what you're asking, can tailor legacy, the language and even the dialect, the words used, the educational level to the person that it's responding to. And I say that because we are at a wonderful moment in history when it comes to innovation. But shame on us if we get so caught up in all the bad that we lose sight of so much of the good and the opportunities that are there. And shame on us if we ignore the fact that this technology can and likely will increase inequities if we aren't there at the table helping determine who gets access to it and who doesn't. So a great point I think to end on.
Yep. And I have to tell you, a lot of what you said, community health centers have to make sure that they offer some kind of translation services, and that's costly for us.
It is, but it's going to get cheaper because you used to have to pay, a person for every language that you need spoken. Right. Now, like I said, in the next several years, you're going to be able to buy a service, a package that can translate into 20 different languages.
Right, exactly, and I think that's where a lot of our opportunities are with some of the things that even we're required to do. So, if you could give us one call to action as we go through our journey now, under this new bill, and under the requirements that we've got to contend with, what would that be, one call to action for us?
Well, I'm not good at following directions, so I'll give you 3 quick points. Have hope. Have hope because this too shall pass, and there's a lot of opportunity. Number 2, and anyone who follows me on social media, be kind. Be kind. I know we have a mixed audience here. I'm a Christian. When Jesus was asked what are the 2 greatest commandments, love God and love your neighbor. Everything else feeds into that. Be kind to one another. Have hope and be kind. And remember that people need to know that you care before they care what you know. So if you focus on that relationship, everything else will build out from it. Everything else, and if you don't focus on that relationship first, then nothing else you say or do will achieve the optimal goals that you want to achieve.
Well, thank you.
Thank you. It's a Tapper tomorrow night. You know, I've done Sean Hannity and Rachel Maddow. I didn't know how she was going to be, but she was pretty darn great.
You know,
and you're much nicer than any of those folks are.
I was just getting ready to say that. Say that. But no, I will tell you the one thing that these folks are used to when we work together is candor and vision, and that's one of the things that I always try to put out there. And I really appreciate you taking the time. And I knew when we reached out to Dr. Adams, having looked at him and followed him and heard about the book coming out, that he was going to be able to provide some good insight to us. So I really appreciate your time.
And I'm not pushing my book. I don't make any money off of it. I actually donate the profits to give books to students and young people out there. But my book is available on Amazon, and I talk about a lot of what we talked about in here, particularly the opportunities and the challenges from COVID, and a lot of my, again, part memoir, a lot of my personal story and how I dealt with my own contentious and negative time. I had, like I said, I had Ebola, I had COVID, I had the opioid epidemic, and so yes, when I say this too shall pass, this isn't me being Pollyanna-ish. This is me speaking from personal experience, being, literally with the world leaders at some of the most contentious times in history. So I do believe, I do have hope that we can get through this and be better because I've lived it.
So, before we let him go, does anybody have any questions or thoughts that they'd like to share?
They're tired of hearing from me, but I am happy to answer any